So diabetes is usually, when we get to diagnose it, is elevated fasting blood sugar. Now when you test for it, it can also be seen in the HbA1c of the patient when they do their blood works.
Unang-una kasi, once na magka-diabetes ka o masabihin diabetic ka, ang pinakaunang dapat mangyari is acceptance.
Of course, so we are nearing now the pandemic. We hope we will open up. Of course, we have to take care of our health, be mindful of the stress, take care of our mental health, do lifestyle modification, nutrition, exercise, and at the end of it all, we treat ourselves well.
Diabetes has been a consistent concern for a lot of Filipinos throughout the years. But what exactly is this condition? What is diabetes? To help us with explaining this, we have with us Dr. Kat Bundalya. She's an internist, lifestyle medicine specialist at the Lifestyle, Wellness, and Aesthetic Institute at the Medical City. Hello, Dr. Kat, and thank you for joining us here on MedTalk Health Talk. Dr. Kat, diabetes ang topic natin for today. Pag-usapan natin yon. Maraming Filipinos ang naririnig ang diabetes. It's not uncommon to a lot of people, but what exactly is it?
So diabetes is usually, when we get to diagnose it, is elevated fasting blood sugar. Now when you test for it, it can also be seen in the HbA1c of the patient when they do their blood works. But yes, diabetes is diagnosed when you have fasting blood sugar of more than 120 or HbA1c more than 6.5.
Pagdating sa simptomas, Dr. Kat, merong bang paraan para malaman ng isang tao na diabetic na siya? Anong mga simptomas ng diabetes?
So usually sa clinic, pagka pumunta sila complaining of yung tinatawag nating 3Ps, So yung polydipsia, polyuria, and polyphagia. Ano ibig sabihin nun? Yung polyuria, ihi ng ihi. Polydipsia, kasi nga ihi ng ihi, so laging nauuhaw, so they always drink. And then they're always hungry. So sometimes they would also come to you na biglang nag-lose ng weight even without the effort of trying to lose weight, bumagsak yung katawan. Or they have non-healing wound or infections, frequent infections. So usually we would screen na. Pero pwede din kasi that they don't have symptoms. So usually if they come in overweight or obese or increased abdominal circumference, signs of black pigmentations on the skin, like the nape, or increased body hair for females. So usually we would also think of insulin resistance, which is a risk for diabetes.
Okay, so diabetes is basically resistance to what the body produces, which is insulin. Pag-usapan naman natin ang mga types ng diabetes because I think importante din ito. What are the different types ng diabetes?
So sa ngayon, there are 3 types of diabetes. So the first one, the type 1 diabetes, is the one that is autoimmune. Ibig sabihin, the pancreas is being destroyed by certain antibodies. So it stops functioning altogether. So the patient becomes dependent on insulin. And then the second type is the more common, usually develops from pre-diabetes, like yun nga yung related sa insulin resistance. And then the pancreas eventually succumbs to the insulin resistance. Then the patient becomes dependent on the medications and the insulin. And the third type is the gestational diabetes. So usually we get this during the 2nd to 3rd trimester of the pregnancy of the female.
Okay, now pag-usapan natin yung second type doon, the diabetes type 2. Now, the reason why we can talk about this more is this is something that is preventable. It is preventable, especially, you mentioned a portion here which is pre-diabetic. Ano ba yung pre-diabetic, Dr. Kat?
So, pre-diabetes always linked to insulin resistance. Una, insulin is a hormone na pinoproduce ng pancreas natin to lower down the blood sugar level. What it does is it directs the glucose from the blood towards the liver, to the muscles, so that it can be broken down for energy purposes. So when insulin resistance happens, hindi na ganun ka-effective yung insulin to bring the sugar to the muscles and the liver. Hence, it is more difficult for the body to lower down the blood sugar level. But the time comes that it becomes overwhelmed, a lot of cells being destroyed already, the beta cells, Kaya magde-develop na ng diabetes yung individual kasi hindi na mapababa yung blood sugar level.
So, okay na ba kung hindi ako overweight, hindi ako obese, kasya pa ako sa mga damit ko, wala na ba akong risk na magka-diabetes?
Meron pa din kasi there are also other risk factors for diabetes, no? So family history, genetics, sometimes that is something that you cannot avoid. Talagang mangyayari siya. There are also people who are not obese but you have to look at the waist-hip ratio or the abdominal circumference, no? So yung tinatawag natin na central obesity. So people with increased abdominal circumference can be at higher risk for insulin resistance. If they don't do anything about it, that can also lead to diabetes.
What is the best thing that they should do kapag meron na silang tips dun sa doktor nila na they are pre-diabetic?
You have to identify what are my risk factors to develop diabetes. You have to look at your diet, no? So you try to lessen your total carbohydrate intake so that you don't overwork your pancreas in releasing insulin. Second, you have to be active physically, no? So in that way, you're able to burn calories and avoid storing excess in the form of fat. And then lower body fat would mean lower risk of having insulin resistance. So that's why exercise is also important.
Speaking of diet, Dr. Kat, marami sa ating mga Pilipino, pag narinig nila yung diabetes, they associate it with, kaya siya nagka-diabetes dahil mahilig kumain ng matamis yan. Doon lang ba natin nakukuha ang carbohydrates sa mga tatamis, candy, cake, soft drinks?
So hindi lang yon, marami rin kasing matataas ang carbohydrates katulad ng kanin, di ba? Yung only rice, mahilig tayo dyan, mga Pinoy. Yung pandesal natin or yung mga bread natin ang tatamis. Pandesal, high refined starches would also mean higher carbohydrate.
What is it about the Filipino lifestyle that predisposes them or makes them prone to having diabetes?
If we look at the FNRI data na latest, yung 2018, 40% ng Filipinos actually hindi nag-exercise. That's statistics, no? And then, like 4 out of 10, hindi nag-exercise. And then, the obesity is very high in the Philippines, no? Like, if you look at the all-age data, 37% yung obese, no? But if you look at the age for the working group, 40 to 59-year-old, nasa around 40% yung obese, no? So, very high yung natin. Obese due to nutritional compromise and then also lack of exercise.
Dr. Kat, significant na ba? Can it be considered exercise if I walk in the mall every Sunday shopping with my family?
Yes, kulang yon, kasi kung once a week mo lang gagawin. Actually, societies would recommend that we do 150 minutes of moderate aerobic exercises per week plus exercises that will tone our muscles also. But I always tell my patients, it's also important that you try to do something than not doing anything at all. Kasi a lot of times busy, mahirap isingit sa schedule, totoo naman. Pero ang important is we do something very regular in terms of physical activity.
Thank you so much, Dr. Kat. Marami ka talagang ibigay sa aming information. But before we go, do you have any advice for our viewers out there, especially those who might be too busy with their schedule to really, tutukan yung kanilang health, hindi sila sure, baka pre-diabetic na pala sila. What advice can you give them?
Usually, we advise our patients to get regular screenings, so annual at least. Pero pag higher risk, a lot of other risk factors identified, mas maganda, mas madalas. And then, lifestyle changes, so yun nga, very important yung impact ng diet, ng exercise, physical activity, stress, management of stress, kasi it's also being linked diabetes in some ways, yung risk factor.
How does stress affect or increase the risk of diabetes in a person?
When we are stressed, ang common response natin is to actually do things afterwards na would relieve the stress, like binge eating, turning to vices. So, malaking factor yon. And then also, increase in cortisol levels would also have a factor in insulin resistance, development of insulin resistance also.
So thank you very much, Dr. Kat, for all that very crucial and vital information and practical information, especially when it comes to diabetes. So taking care and just small changes in your lifestyle can have a big impact on your risk of developing diabetes. When MedTalk Health Talk returns, we'll talk to someone and their journey with diabetes. So keep it here on MedTalk Health Talk. As with most diseases, diabetes comes with its own set of challenges. But this doesn't mean that you can't live a full and healthy life. Let's listen to someone living with this condition.
Ako po ay si Cynthia Clement Duntz, Board Director and Vice President ng Philippine Diabetes Support and Awareness Group, Inc. I am an architect by profession. Nung bago ako ma-diagnose, madalas kami magbiyahe abroad, locally. And then usually, pag galing sa abroad, pagbalik, daming chocolate, kilo-kilong chocolate at dala. Kinakain ko almost every day. I mean, as an architect and working, talagang night owls kami. Talagang gising sa umaga, gising din sa gabi. Talagang ang work namin, talagang long haul talaga ang aming trabaho. Actually, mas madalas noon. Kasi single ako eh. So, instead of cooking, sa labas na lang, fast food, ganon. Every weekend, nasa Lakwatsa. And then yun nga, every month, biyahe talaga kami. Actually, since nagbabiyahe kami every month, so pinupost namin sa Facebook, ganon. Ako hindi ko napapansin sarili ko. So, yung isang friend ko, napansin niya, the month before at saka yung present na, yung kapopost ko lang, ang layo ng katawan ko. Tinawagan niya ako, tapos sinabi niya, ang laki daw ng difference, yung taba ko tsaka yung payat. Then, nagtimbang ako, and I found out, I lost 40 pounds in 1 month na walang diet, nothing. So yun, nagpa-check up ako. Actually, yung pagdating ko sa laboratory, basic pa yung kinuha sa akin eh. Buti na lang, yung isang doktor doon kilala yung family namin, so sinabihan yung tumingin sa akin na check the blood sugar. Yun na nga, nung time na yun, nung kinunan uli ako ng dugo, and then nung iniintay ko yung result, that's about 2 to 3 days, I'm losing 4 pounds a day na. Nung malaman na nga, nakita niya, oh, ang taas, diabetic ka na. So, hindi na ako dumaan sa pre-diabetic. Well, noon, syempre, bago ka lang eh. So, iniisip mo na yun, maraming mawawala. Pero, through education and malalaman mo na, pwede pa rin naman pala. Yung ika nga sabi nga sa akin tanggalin yung salitang bawal. Ang importante ay yung kung gaano karami ang kakainin. Noong una sinunod ko yung doktor ko yung kakainin lahat. Mga 4 days pa lang nagbagsak na yung blood sugar ko. Talagang hypoglycemic na ako. So from then on, ina-adjust ko. Hinahabol ko yung blood sugar na hindi naman dapat masyadong bumagsak at hindi naman dapat tumaas. Ganon. Hanggang sa nakasanayan ko na. From then on, nag-brown rice na kami. Then, lately, siguro mga 2 years, naglabasan yung mga low glycemic index na mga na rice. So, yun ang kinakain namin ngayon. Actually, sa food, mas mura nga kasi you are encouraged to eat green vegetables. Kesa magbaboy ka or, mga baka. Unang-una kasi, once na magka-diabetes ka o masabihin diabetic ka, ang pinakaunang dapat mangyari is acceptance. Kasi walang mangyayari pagka hindi mo in-accept paglabanan mo Titigas lang ulo mo, hindi ka lang susunod. So, i-acceptin mo na diabetic ka. So, kami naman kasi, since na family of diabetics kami, nakagawian na rin Parang welcome to the club na kami Every 3 months kasi nagpapa-check up, laboratory test para kung ano man ang complication, magsimula, maagapan. Like yung effect ng isang gamot sa akin, na medyo hindi hiyang sa akin, tumaas ang SGPT ko. So, nagapan. Nagnormal agad. Kailangan mo talaga ng regular and then yung gamot. Yun lang naman ang gamutan unless na nagpabaya ka talaga. Yun ang marami kang gagamutin. Kasi ang type 1, hindi nag-produce ng insulin yung katawan, no? So, nakaasa sa insulin ang type 1. So, kahit kumakain ng marami ka, halo-halo pa nga kinakompute nila And then, tinatapatan nila ng injection. Then, solve na. Mababa na yan. Hindi kagaya ng type 2, pag tumaas, walang pang-rescue. Talagang, pag nag-check at mataas, ay naku, babawasan ko ang pagkain ko mamayang gabi. Parang ganon. Yung talagang matagal ang recovery. Ang ginagamit ko ngayon is yung CGM, yung continuous glucose monitoring. Kasi, asymptomatic ako. So, hindi ko nararamdaman kung bagsak ang blood sugar ko or mataas. So, as in, minsan nagulat siya nung pag-test niya, naging talagang 2.6, which is 4 ang borderline nun, So, nag 2.6 ako, nagulat siya nung makita niya. Sabi niya, delikado to, baka bumagsak ka na lang. That time, hindi pa ako diagnosed diabetes. Pagpasok ko nun sa yung scanner, doon lang, para akong kandila na bumagsak. Wala na. Pinaupo nila ako sa cart, and then dinala ako sa basement. Yung nandun yung clinics nila eh. Tapos tinanong niya ako kung tutuloy pa ako. Sabi ko, yes, because set up na yung mga meetings ko. So, tuloy pa rin ako sa biyahe ko. Kulang sa edukasyon sa Philippines. Last year lang, naging medyo ang government natin sa diabetes eh. Kasi alarming na. Imagine mo ilan ang milyon? It's about 4 million na siguro ngayon, diagnosed ha. And then, another 4 million undiagnosed. Yun, nagsasearch ako at nakita ko yung Philippine Diabetes Support. Ayun, so nag-join ako. Naging active ako na parang naging advocacy ko na tuloy. Pasalamat nga ako dahil ang daming mga doktor na nag-join. Mga caregivers, mga nurses. Isang nutritionist nga nag-message sa akin, Cynthia, pwede bang paki-message yung isang member nyo? Kasi gusto kong tulungan, nakakaawa naman. Nahirap kasi ngayon, nahirap yung importation eh. Talagang nawawala ng stock. Marami na nagagawa na kami ng activities. And then may mga nagdo-donate din na mga, minsan financial. Ang daming humingi ng tulong eh.
Diet can make a huge difference in the quality of life of people with diabetes. More on this when we return, so keep it here on Med Talk Health Talk. Welcome back to Med Talk Health Talk. Now, diabetes is a chronic condition, but there are effective ways in which one can manage this. Now, to talk about the effective ways of management of diabetes, we have with us Dr. Caroline N. Montano. She is the president of the Philippine College of Endocrinology, Diabetes, and Metabolism. Please explain to us kung anong epekto ba nito sa isang tao, not just the spikes of sugar sa blood, but also the spikes of insulin.
When we talk of these things, so we have to take into consideration glucose or sugar. We take into consideration the pancreas, which produces the insulin, and then we take into consideration the absorption of the different organs. So when we take in food or carbohydrate, the pancreas will now produce insulin to break down this carbohydrate, and then this carbohydrate or glucose will now be absorbed by the liver, adipose tissue, and our muscle. So in a healthy individual, there will be no more spikes because it will be absorbed. But for our diabetic patients, there's really an elevation of the blood glucose because there is less absorption of this glucose.
Is there a healthy amount of sugar that people can take in?
Males are allowed about 9 teaspoons of added sugar, but for females and for children 2 to 18 years of age, only 6 teaspoons of added sugar is allowed.
Automatic ba na mas healthier pag sinabing sugar-free diet?
Okay, so when we talk of zero diet or low sugar, it is more pertaining to the amount of sugar that they have. So usually it's less than 0.5 grams of sugar. So there's still sugar, but it is less than the recommended amount. So there's a thing that you can have an extra intake of this one. Now, is it more healthy? The thing is, it would add a little calories still. So you just have to do it in moderation.
Please explain to us, ano ba talaga itong glycemic index and paano ba ito nakakapag-impact sa health ng isang tao?
When you talk of choosing the carbohydrate that you want to take, look for a lower glycemic index. So glycemic index is the ability of the food or the carbohydrate to cause the spikes of blood glucose or sugar after intake of that food.
Ano ba talaga, doktora, ang mga examples ng mga low glycemic index food?
For us, we go for fruits. No? So when we talk of fruits, may banana, low glycemic, apple, suha, vegetable, almost all vegetables have low glycemic index foods. Sometimes peanuts. Of course, high glycemic index foods would be the donut, the processed food.
Is there a simpler way to really be sure na yung tinitake in ko ay tama yung glycemic index?
Yeah, so there's an easy way. So we have an available meal replacement formulas. So these are nutritionally computed wherein it is low glycemics and it is a computed calorie. So you can take it as a meal replacement for either lunch or breakfast or dinner time.
And these are very good, especially for those with diabetes and pre-diabetics as well. What would happen to a person with such a high level of sugar in their body?
Well, we know that when we take in too much sugar, there are a lot of conditions that can happen. It can increase our weight. So we know that obesity is the primary independent risk factor for developing diabetes. When we take in too much sugar, it causes some inflammation or swelling in the blood vessels that causes the deposit of the cholesterol. Then we'll have high cardiovascular events, stroke, heart attack. And then on the cosmetic side, when we take in too much sugar, we'll have acne. There are reports on cognitive decline, so when we take in too much sugar.
Let's talk about the lifestyle changes na pwedeng gawin ng mga tao, lalong-lalo na yung mga diagnosed with diabetes.
The Philippine College of Endocrinology, Diabetes and Metabolism have this apat-dapat system for our diabetic patients. So it goes for exercise, diet, of course, intake of medications, and going to the doctor for checkup. But for our pre-diabetic or even healthy individuals, we more or less want to have a system wherein we would promote healthy lifestyle. So how are we going to do that? We'll have diet, of course, nutrition awareness, exercise, avoid smoking, please, and of course, avoid the stress. So find ways to avoid stress.
Pag-usapan natin yung mga pre-diabetic. Please explain to us what is pre-diabetic at importante din ba ang glycemic index para sa mga pre-diabetic?
Of course, so pre-diabetic are those people whose blood sugar would be on the fasting in the range of 100 to 125. Or if you want to take it the 2 hours, it would be in the 139 to 199. Okay, so these are the pre-diabetic people. So if you're already pre-diabetic, avoid being obese, and the high glycemic index food would cause the rises of the glucoses. You'll feel a little more, you want more food, you'll get more hungry that often. As compared to low glycemic index food, you'll feel full once you take this kind of foods. That's the reason why you won't eat too much food during that meal.
So let's talk about that. Carbohydrate complex food, how important is that alongside with the low glycemic index food?
The release of the blood glucose is less, or there's no spikes as compared to simple sugar. So simple sugars have high glycemic index type. These are high glycemic index type of food wherein you would have a spike of the blood sugar and then suddenly it goes down.
But before we go, do you have any tips for our viewers, especially those who are diagnosed to be diabetic as well as the pre-diabetics?
Of course, so we are nearing now the pandemic. We hope we will open up. Of course, we have to take care of our health, be mindful of the stress, take care of our mental health, do lifestyle modification, nutrition, exercise, and at the end of it all, we treat ourselves well.
Okay, thank you very much for that, Doctora. Now, diabetes does require a commitment to a healthy lifestyle, but if we do follow that healthy lifestyle, we can manage diabetes well and live a full and healthy life. I'm Dr. Freddy Gomez, and thank you for joining us here on Med Talk Health Talk.
This program is brought to you by